Nationally, suicide deaths among 15 to 23-year-olds were 11% lower than what researchers expected between 2022 and 24, when the National Suicide and Crisis Hotline debuted the shorter 988 number. And here with us to discuss the connection and possible impact is Sweetser's Chief Program Officer, Kristie Worcester. Kristie, thank you so much. We appreciate it. This is a very important topic. So can we attribute the reduction to 988?
Yeah, thank you so much. I think that this is very important data, and I think it certainly is contributing. We've also seen other important things that are happening, such as evidence-based treatment, environmental supports, and things like coping skills being used more in schools. So this is definitely, very important, to recognize. The thing about 988 is that it certainly is a shorter number. You can text it and chat online with this number, which is so important. And all populations now are texting more. This is very attractive to particularly the younger population. It is in the moment texting with trained crisis support professionals that can help to de-escalate if you're having a crisis, give emotional support for depression, or anything that really is going on for somebody in the moment, and that's so important. And in addition to that, it's also to help it navigate a very complex system for some people, and it really helps lower the barriers. And of course, people can call as well. I think the other thing is we have a very easy to remember number for our medical emergencies. This now is a very easy to remember number for our mental health crises.
Yeah, and similar to the 911 in exactly. a certain way. Yeah. Should we be encouraged that the mental health of our young people is improving?
Yes, I think we absolutely, should. This is very promising, right? I mean, it shows that there's a lot more attention on this subject, that there is more treatment and access, across the country, and that people are using this number. I think that being said, we also, need to recognize that we can't stop the work that we're doing, right? There's still so much more to be done. And I think in the state of Maine, we need to recognize that our youth are still struggling compared to other youth nationally. We still have very high depression rates, anxiety rates, and suicidal ideation is still high in the state of Maine. In our state, we have youth that are on wait lists for outpatient therapy, home and community-based treatments, and higher levels of care or more acute levels such as residential treatment. And the longer that our youth wait on those wait lists, the more that they can deteriorate or get worse. And so that's important. And, some of those higher levels of care that we're talking about, those are hard to access. They are at risk of closing because there's not a lot of beds. Kids are, again, being sent out of state, and, the work isn't done on that. And so, organizations like Sweetser, we continue to advocate and do that work. And to fight for access. So we still are working towards that. Exactly. Yes. And trying to get the kids the access. That being said, I feel very positive about these results. Anytime we can see, this, suicidal ideation coming down, it's very promising.
Yeah,
I feel good about that.
All right, Kristie, thank you so much for joining us. We
absolutely.
appreciate this information. It's an important topic.